October, as you know, is Breast Cancer Awareness Month. Always a good time to remind ourselves of the importance of getting yearly mammograms. And here to drive that point home even a little bit further for us is Dr. Takeyla Williams. She is a breast surgeon at the Mary Ellen Locher Breast Center here in Chattanooga. Good to see you this morning.
Good to see you.
So do you think that we get an A on getting those mammograms, or do too many of us still keep putting it off?
You know what? Before, when the pandemic started, we weren't doing that well, but now those are picking back up, and I think we're headed to getting back on the right track.
So you hold a very special designation because you are a breast surgeon, but you have gone through fellowships to have an added level of skill that you bring to your patients each and every day.
Yes. So both my partners and myself, so all three of us, were all fellowship trained breast surgeons. So yes, we did extra training where we only specialize in breast. So our initial training was done in general surgery, but we went further to specialize in only doing breast surgery.
You know, it wasn't too long ago, I'm going to lose track of time, but maybe a year to a year and a half maybe, and the hospital was very, very excited and proud with the 3D mammography that you were able to offer. That has become something that, as I understand it, you really rely on, especially for women who have denser breast tissue. Is that right?
Definitely. So, you know, the difference between a 2D mammography and 3D mammography, I kind of explain it as it's like getting a CT scan of the breast. And so it just gives us a lot more pictures. It gives us a lot better views of the breast. And the good thing now is that we have 3D mammography at all 4 of our locations.
You mentioned a minute ago about COVID and how that has in some ways kind of encouraged people to take better care of their health, reminding us all of how fragile it can be. On the other side, there are people who've been impacted financially from COVID, and they might be a little bit hesitant to go and get a mammogram. Do you have financial assistance that you provide for people who need it?
We sure do. And so we always tell, even outside of the pandemic, there's always been resources for people that are uninsured or underinsured. And so definitely here at Mary Ellen Locher, we have assistance with providing patients what they need to get their screening mammograms. And so we always say, don't let that be a barrier to seeking treatment.
I don't think the question that I'm about to ask you will come as a surprise to anybody who's been in Chattanooga any length of time, but it is still always, I think, comforting to hear, because you never know who's going to have a diagnosis of breast cancer. Once you get that diagnosis and you're in the arms of your staff at Mary Ellen Locher, you are not walking alone. There is a comprehensive approach that you take as a group.
Yes, so we have a multidisciplinary practice, and so, you know, once you get diagnosed with cancer, you're going to be connected to a breast surgeon, a medical oncologist, a radiologist, a radiation oncologist. So there are multiple people. You know, some people may even require a plastic surgeon, and so definitely we treat the patients kind of in a comprehensive way, and we try, like you said, it's not just the patient, but it's their family. So we try to make that process as seamless as possible.
And do you find that there are still some misconceptions among women who think that maybe they're kind of in the clear, if you will, because there's no family history of breast cancer, when in fact there doesn't have to be a family history to receive a diagnosis?
Yes. So only about 5% of all of our diagnoses are related to a gene mutation that increases your risk of developing a breast cancer. So 95% of breast cancers that we diagnose are sporadic or random, and you know what we call multifactorial. It has nothing to do with genetics. And so a lot of our patients come in and they say, hey, I'm the first person to develop a breast cancer in my family, and that's not uncommon to hear.
I might be setting you up, but I know your mobile mammography has always been such a benefit to people. Do you know if you're able to still utilize that with COVID, or are you having to do things more stationary right now?
No, we're definitely still utilizing it, and that, like you said, that's also one of the things that helps kind of break down some of those barriers to seeking treatment, because some people are not able to actually get to the Mary Ellen Locher Center at our different locations, and so we have our mobile coaches that go around and also help do screening as well.
Okay, and I guess parting words, it's always good to have words of hope. there is hope now that wasn't always there in years past. If you receive a breast cancer diagnosis, the treatment is really, really effective.
Yes. So, 50, 60 years ago, most people heard the word cancer or breast cancer and they thought it was a death sentence. But now we're just so much better at our treatment modalities, our screening modalities. We've just gotten better over time, and hopefully we'll continue to get better. And I at least, get to tell most of my patients that this is not going to be something that you're going to die from. And, 6 months, a year down the line, will be just another bump in the road that you had to get over.
Well, we are so glad that you could spend some time with us this morning and that you're part of the practice there at Mary Ellen Locher. You just joined pretty recently, right?
Yes, I joined December of 2019.
Just in time for COVID.
Yes.
All right. Well, thank you so much for your time this morning, Dr. Williams.
Thank you.
Again, as she mentioned, she and the other 2 doctors there in the practice are all fellowship trained. You can get in touch with them by calling the number on your screen. The website is there. Locations now in Chattanooga, Hickston, Ooltewah, and Ringgold to keep your health at its optimum. We're back after this.